Hi everyone, I'm your fave Nurse B. Welcome back to Nursemas Day. I don't know what day because I am not keeping up with the dates, but we are doing this. Basically, I'm doing a video every day for the next, well, for 12 days total, all the way up until Christmas. And I also will be having giveaways here on the channel. And also on my other social media platforms. So make sure you follow me on all my platforms. That way you are able to enter into all the giveaways. You have up until 11:59 on Christmas Eve to enter the giveaways. So you can enter all of them. But yeah, let's get into this video. First, I want to thank everybody who has donated to my PayPal account. Like, oh my goodness, like the messages y'all have been leaving me, it's just so sweet. Like, I really appreciate it. Like, it really shows like y'all really believe in me, along with you all subscribing and liking and sharing my content and then commenting on my content. You all DM me and email me. Like, y'all have been showing me so much love, so I really appreciate it. So if you want to contribute to the channel and contribute to me going back to my RN, please donate to my PayPal account, asking for just half of my subscribers to donate $1 or more if you want and if you can. That way it'll help pay for my debt that I have to school, and I'll be able to go back to get my RN. Also, some people are interested in these earrings that I always wear in my videos. I will be having them for sale. So I'll post it when I have them for sale. It's gonna be sometime soon. It's lipstick. Yeah, I'm getting my life together. So if you all do not know, I'm an LP in a long-term care facility. I work at a pretty big facility, and yeah, it's a big facility, and I've been working there total 6 years and almost 4 years as a nurse. Okay, so first thing you need to understand with long-term care is that just because you're dealing with older adults does not mean that you don't have any type of emergency situations, acute care situations, and things where things have to be really fast paced. Just because they old don't mean that they not going through things. Really, with elderly patients, you have to watch them, you have to understand them and know them a little bit even better, because sometimes the changes that they have are very subtle. You know, they might not spike a temperature like me or you. They might not do that. Their body might not respond that way. They might not be able to verbalize pain or discomfort, things like that. So you have to be very observant when it comes to your elderly patient. You have to ask questions of the patients, of family members, of other staff members, other nurses, CNAs, whatever the case may be. You have to be very observant to find those subtle changes that could really cascade into this person, you know, ultimately dying. Because usually, you know, small stuff can really take an elderly patient out. So, but also something as simple as just hydrating your patients can make a world of difference. If you keep your patients hydrated, like, you're winning. I'm telling you, when it comes to elderly patients, keep them hydrated. Now, of course, there's some like clinical, they might have some certain diseases where you wouldn't want to keep them hydrated as much, or you want to kind of keep it like fluid restrictions like CHF. But for the most part, you want to hydrate your patients as much as possible. It doesn't have to be just water. It could be anything. Just some liquid in their body will make a huge difference with elderly patients. Okay, but let's get into like what to expect in the actual setting. So, okay. So first things first is you need to understand that she's coming from a clinic position. So I'm not sure if she supervises people, like if she supervises, you know, patient care techs or CNAs in the setting that she's in. It might just be her and the MD and that's it. So when you're working in long-term care, you have to supervise CNAs and CMTs. For the most part, it's just CNAs, because CMTs, they got it, they win it. But you really have to watch your CNAs, because they make the difference as far as like if you're gonna have a good day or a bad day. If your patients are gonna get what they need, like your CNAs make a huge difference. And that's a whole nother video. I think I got a few videos about like leadership and delegation and communicating with CNAs. So I will link them down below. Yeah, I'm gonna link them or have them somewhere, but go check those out. But supervising people is a whole nother ball game, y'all. Like, yeah, you need your CNAs. They are so important. Like when you have a good CNA, make sure you appreciate them and you talk to them and you say thank you. Like, I appreciate that you did X, Y, and Z. Tell them exactly what it is. Tell them in front of everybody, so everybody be like, dang, like, okay, well, let me step up my game. Because I'm telling you, that's like one of the biggest things that like turns people off from long-term care is having to supervise people. Because basically you're trying to tell another adult how to do their job, and they look at you as a nurse like, she not doing nothing, he ain't doing nothing. Like, what do they know? They could have did it, da, da, da. It becomes like a huge issue in long-term care. At least I know. And then also something else to think about is in long-term care, you do have a lot of staffing issues. Now, this is the case pretty much with nursing all across the board. But the thing with long-term care is when you're short-staffed, it's like sucks. Because say, I'm going to give you an example. In my facility, we have 2 nurses on each floor. Now, if at some point, you know, we drop a nurse, something happens, I go from having about maybe anywhere on just a long-term care floor, anywhere between 20 to like 26 patients by myself with another nurse, to having about, you know, 50 to 60 patients by myself. And this could be a day shift or an evening shift. Or even, you know, on night shift, you already have 60 patients by yourself at the facility I work at. So, you know, that right there is a deal breaker for a lot of nurses, especially if you're coming from a hospital setting. Like typically, like maybe the most you might have is 8 patients, and that could be probably like a heavy load. Some people like may have 10, something like that. So to go from that to having like 20, 26, 30, 40, 50, 60 patients, like that's a huge like transition. And I know people be like, how do you handle having that many patients? Like, how do you do that? Y'all, I don't know. I mean, I could do a video talking about that if you all want to know like how to handle like a heavy patient load and time management, stuff like that. I will get into that. But this video is kind of giving you a little bit of what to expect. But that's something. Another thing is, okay, so that's how it would be with a nurse with you being short staffed. With a CNA though, they could go from maybe having on a good day 12, 16 patients to having like 20, 25 patients to one CNA. They have to toilet these patients, shower these patients, feed these patients, get them up and down in the bed, up and down in the bed, answer call lights, communicate with family that might come in and ask questions and want to know why mom doesn't have this and mom doesn't have that. Have to deal with the nurse if the nurse is on them about something, doing vital signs. So that's a lot on a CNA. Even without being short staffed, it's still a lot, because think about how many times you use the bathroom all day if you're eating and drinking. Like, and you have to take care of that patient, clean that patient, toilet that patient, on top of doing that for like 10 plus people in an 8-hour shift, and you have to do showers, and you still gotta take your own break if you can. So it's a lot of work, y'all. I'm glad those days are over. Shout out to all my CNAs out there. Thumbs up if you are a CNA. Let me know if you're interested in becoming a nurse, if you work in long-term care and all that good stuff. Let me know in the comment section. I would love to know, as a former CNA, I would love to know like where you are in life and what you're working towards. But moving on, let me see if there's anything else specifically that she asked. She did ask about managing time, so I will talk about that. Something else to expect is, let me think. You're just gonna have to do a lot of investigative work, like looking through charts, looking through the computer, talking to family members, talking to CNAs to get an idea of how this patient is. But let's get into like some tips to help you to get through it and to manage it. Now, as far as managing your time, I do have a video about time management. I have a video about everything. I got 100 plus videos on this channel, so go watch them. But support your favorite nurse B, like, comment, and subscribe. But like as far as like managing your time when it comes to elderly patients, you need to just, when you have that many patients, it's so important to just, you need to first focus on your task. So if you know if you got pain pills and you got diabetic patients, those two, you need to know what time you need to take care of that. So know what time your pain pills are due for the whole shift, and know what time and which patients get accu checks. So if you can get those two down, that'll really, really help you. Because if you're in a room and you gotta check somebody's sugar, and you're like, oh shoot, I gotta give her a pain pill too. Then you gotta leave the room, go get a pain pill, and on halfway there, somebody gonna stop you and be like, ma'am, can you come here and help me with this thermostat? Like, girl, like, it's gonna be a mess. So you need to cluster your tasks, which I talk about this in my time management video, so please go check it out if you have an issue with time management. Like, especially for new CNAs and new nurses, like, managing your time is super important. It makes the difference in the type of work that you're able to do, how much you're able to get done, and just your overall energy. Because if you feel like you just run around and not get nothing done, your whole morale's gonna go down. You'll feel like crap. You're not gonna want to do this anymore. You're gonna feel like, I'm a failure, I can't do this, like everything is just pounding on me, I feel overwhelmed. You're gonna feel horrible. If y'all hear my baby, it's okay. My husband is getting her to bed, so he's giving me a break. I'm super excited about that. So don't worry about the baby, she's fine. And this baby right here is fine too. So anyways, but yes, work on your time management. But like I said, cluster tasks. And let's see. Something else is you need to look at my videos that I have about day nurse, evening nurse, and night nurse, and I talk about the differences. And I'm talking about that, of course, from the reference of a nurse. And so I'm giving you an idea of like what to expect on those different shifts and how to get through those different shifts, because it is a huge difference at a facility. You know, what is going to happen, you know, based off those shifts. It's different as far as the personnel that are there, how many staff members you have, the amount of meals that you have to get people ready for, especially for AccuCheck's day shift. You have to check AccuCheck's twice within your shift. Evening shift just once. Night shift, you might not have to do any at all. So it really just depends, you know. So that's something to think about too with long-term care. But I would say the biggest thing is, like I said, know those two tasks that you have to do. Your AccuChecks and your pain pills, because people hound you for pain pills all the time. And then your AccuChecks, you really need to know that, because I mean that could be a really quick change with a patient, and that's really, you know, blood sugars are important to know that with your diabetic patients, and that's something you're going to get a lot in geriatrics. So after doing that, then I would say something that you might want to work on or look into or think about is your assessment skills. Now this is the case for all nurses, is that we have to have strong ability to assess our patients, especially like I said with elderly, because changes with them happen very acutely. They happen very like in a subtle way, but things can get really serious like quickly. So you need to know what to look out for, and you will learn that over time. But ask questions, of course, do vital signs and things like that, and talk to your staff members. Like, those are like the key things to do. But assessment is key. But something else I want you all to think about when you're dealing with long-term care is talk to your patients. Sometimes you might think, oh, this person is demented, they don't know what they're talking about. Even if your patient is confused, even if they're not going to say nothing to you, still talk to them. At the end of the day, you have to show your patients dignity, and you might get something out of that patient that seems super confused. They might say something to you, and you be like, well, shoot, is that the case? And she might be like, burn, you know, and you be like, what the heck? Like, maybe her vagina is burning. This girl, she might have, not this girl, but it might be dirty, or she might be having a UTI. You don't know. So communicate with your patients, one, because it's a form of dignity and respect that you're showing them, that you're, you know, even if you have a patient who doesn't talk at all, completely just, you don't think they're there, they're not, you don't know what's inside that person. You don't know what facilities they have. So, and also you just coming in, touching somebody, pushing them and doing all that. No, you need to like show them some respect. Okay, now that's a whole other video, which I got a whole other video about that. But that's one thing I would say. And also you could get some good information from your patients, even if you think they are confused. Oh, but something else is, this is what I do. Let me just tell y'all. When I go in and I don't know a facility, I don't know what to expect, the first three things I look at, like I said, is AccuChecks and pain pills. Also, I want to know what wounds do I need to do. So who has a treatment on their butt, leg, thigh, hip, eye, I don't know. I want to know who has treatments, because I want to be able to get those treatments out the way, because your patients sometimes they're sitting, they get them up and they don't put them down until never. The person's up in the chair for 8 hours. That's a whole nother video. That can easily happen. And you heard you go, this patient got a hole on her coccyx, and you looking at the ceiling like, so when we gonna lay her down so I can do this? And the ceiling like, we don't lay her back down. Once we get her up, she up for the rest of the shift. So find out those 3 things when you first come in. Even while you're doing a report, be like, hey, you know, who do you know has wounds? Ask that nurse. I'm telling you, it will help you, because if you can jump in and get them done, like get your wounds done, get them out the way, like whatever happens that day, like you good, because you know that those big things are done. You know, getting treatments done is a huge thing. Now, of course, slapping some use around somebody's legs is important, but if something were to happen, you couldn't get to that, you know, that's not as important as you making sure that this person who has a stage 3 pressure ulcer on their sacrum or on their coccyx is done. Like, you have to make sure stuff like that is completed. Because what does it look like if, here it is, you didn't do that person treatment, the next day another nurse come in, they're like, this treatment been on her for 2 days, nobody changed this treatment. You look horrible. You didn't do nothing. That's what it looked like to me. You didn't do nothing. What you do all day? You couldn't even get this person treatment done. So look at those 3 things. And it's so important. Like, it's so easy to just get that during a report. If you have a nurse who actually knows the patients and everything, be like, hey, let me know who is a fall risk, who, just be a report like, okay, so who got accu checks, who a fall risk, or who got wounds, something like that, or who got pain pills. Like, I don't know these people like, so just kind of tell me like a little bit what you know. They may or may not know, they might not do it. You might not even get a report. But if you do, you know, try to get some type of feedback from the nurses, just so you can, your day can go by a lot quicker, a lot easier. So get things done early in the shift, as early as possible, because you might have a fall, you might have an emergency, you might check somebody's blood sugar, it's 500, or it might just say high, which in my facility, our machines, that means it's over 600. So you're like, what do I do with high? Like, so you got to call the doctor, wait for the doctor to call back. You got to get this, give that. You might have to send that patient out. You got to call the family and talk to them. They might be like, why is this happening? Da, da, da. So much can happen in long-term care. And like I said, they're not just little bitty old people sitting there doing nothing all day. Like, you or their nurse, you will have a lot of patients. And you will have to supervise people. And you will need to pay attention to your patients, but focus on those 3 things: accu checks, pain pills, and wounds. And that should be a really good start to help you, you know, to get through the shift and to be as like quick as possible. But do expect falls, expect changes, expect, if you're a new face, they're gonna try you. You're a new face, they're gonna try you. But just be optimistic. And geriatrics, I love old people. I love elderly patients, because they got a lot to contribute to this world, and a lot of times we kind of just push them to the side. But like, you gotta take care of your elderly patients. So I hope I answered your question. Thank you so much for DMing me on Instagram. So if you all want to send me questions, or just like be like, hey, Nurse B, I need somebody to talk to, whatever the case may be, you can hit me up on Instagram on at YourFavNurseB 1, or you can also email me at YourFavNurseB@gmail.com. Thanks again. Like I said, thanks again for all the donations through PayPal, for liking my videos, for commenting and subscribing, and also join the Fave Nurse B Facebook group, because we have so many diverse people on that channel. Because we have so many diverse people on that group. Like, it's super helpful and it's growing. And congratulations to everybody who has passed their first term of nursing school. I'm seeing a lot of posts about that, so I'm super excited for you all. So we do have a giveaway in this video. Let me go ahead and go get it for y'all. I'll be right back. The viewer who submitted this question, she also asked, like, what is she expected to do? So I kind of went over it, but let me be like a little bit more direct. You're expected to supervise, do assessments, of course, contact MDs, take off any type of MD orders that you see, so verify orders. You have to be in communication with the lab, with the pharmacy, with family members. Like, if something happens to a patient, to be in communication with the family members or whoever the power of attorney is. You're expected to chart. That's important too. Like, that's like the 4th thing I would say, along with accu checks, pain, wounds. You have to know who you have to chart on. So some facilities are chart by exception. Some, depending on the floor you work on, you have to chart every day on everybody, if it's like a rehab floor. So with chart by exception, that means you chart on patients who have had falls, change in conditions, they've been on a new medication. Sometimes you have to chart on them, and then like if they had like a scar or a bruise, not a scar, like a wound. Sometimes if they are getting, what do you see? Sometimes some facilities have, they call it MOQI or whatever, or at least where I'm at. Basically, like the facility is getting paid extra money to treat them, so like you have to deal with those patients and chart on that. But usually like falls and UTIs or any type of antibiotic therapy, like for like, you know, pneumonia or something like that, you have to chart on them, make sure that they are tolerating those antibiotics properly and tolerating them properly. Y'all, I'm tired. Make sure they are tolerating their antibiotics and they're getting fluids, and just charting like if the antibiotic is being effective, like do they still have, you know, how's their breathing and stuff like that, depending on what they're on the antibiotic for. So yeah, those are things you're expected to do. So if you have any more questions, to the viewer who asked me, if you have any more specific questions, leave them in the comment section, or you can also DM me. And let's get into this giveaway. So for this giveaway, you get 3 items. Super girly items. So the first item you'll be receiving is cute pink shimmery cosmetic and pencil case. So I like to take this stuff like this to work all the time. I put all my utensils that I need for writing and charting and stuff like that in here, as well as like, you know, toiletries. Like you might put feminine hygiene products right here, or some lip gloss, some lipstick, some perfume, deodorant, whatever. You can throw it in here. And then also you'll be receiving this cute pen set. So you get this rose, like a rose pink pen, and it has a cute little pineapple at the top. And then this is a case to put the pen in, but you can also put like lipstick or lip gloss, stuff like that in there too. It's real cute. So you'll get that in addition to this cute shimmery girly journal. Oh my gosh, it's so girly. It's so cute. And I like it because it comes with this, you know, the bookmark, and it has like a little charm on the end. I like that type of stuff. But that is the giveaway. So you get these 3 items. I will leave all the description. I will leave all the rules to enter the giveaway in the description box. This giveaway, you do not have to have any type of social media affiliation with me, with the exception of course, subscribing to this channel. So yes, the winner will be announced the day after Christmas. So just put on your notification bell and yeah, watch Your Fave Nurse B. Thanks again for all your support, you all. I am tired. I have to go work a 12-hour shift tomorrow. I'm tired, but I'm getting these videos out to y'all. Like, I'm doing my very best, okay?
Yeah.